Good afternoon, everybody. Myself, Arafath Husna, and this is my co-presentator, Nagma. We are from Dr. VRK Women's Medical College. We are here to present you all an interesting and a rare presentation of pregnancy in a Caesarean scar. Case history. Mrs. S, 27 years old, G3P2L2, was referred to our hospital for evaluation and management of quasi-ectopic pregnancy from a private hospital. The patient was apparently asymptomatic 6 weeks back and had noticed spotting per vaginum on and off for a week with a history of 6 weeks amenorrhea. Her obstetric history shows first lower segment cesarean section delivery of an alive male baby who's 6 years old, and second lower segment cesarean section delivery of an alive female baby 3 years old. Present pregnancy is a quasi-ectopic pregnancy. Her last menstrual period was on 20th of May 2013, and her expected delivery date was on 27th February 2014. On examination, the vitals of the patient were normal. Her blood pressure 110 by 70 mmHg, pulse rate 83 per minute. But abdominal examination was normal, and on performing the pervaginal examination, the findings were bulky uterus with slight tenderness in all the fornices. Now, the management. Evaluation. Her urine pregnancy test was positive, which was followed by ultrasound scanning. This was done in order to confirm the pregnancy, and on performing the ultrasound scanning, the gestational sac was found to be located on the previous Caesarean scar, and the problem was diagnosed as the ectopic pregnancy in the previous surgical scar. In this picture, we can see here is the gestation sac, and this is the colors Dopplers, and this is the rough diagram showing the location of the gestation sac located just behind the scar, previous scar. Plan of management, operative exploration. Preoperatively, surgical profile was done, reserving blood. Laparotomy. The patient was posted to surgery the next day, and the findings were the anterior wall of the uterus was attached to the anterior abdominal wall by adhesions, which was removed by sharp dissection. The uterovesicular fold of the peritoneum was open and the bladder was pushed down. A small bulge was noted at the previous Caesarean scar. Then 1 centimeter transverse incision was made with a cautery over the bulge, following which the sac with contents bulged out. The products of conception were removed and sent for histopathological examination. Then the uterine cavity was digitally evacuated of all the products of conception until there was nothing left, and then the uterine incision was closed in 2 layers. Hemostasis was secured. Then it was followed by tubectomy. Both the fallopian tubes were next ligated by modified Pomeroy's technique, and then the abdomen was closed in layers. The condition of the patient after the surgery was stable. Here in this picture, we can see the incision being given to the gestation sac using a cautery. In this picture, we can see the contents being removed, the contents of gestation sac being removed with the help of an artery forceps. And these are the contents of the gestation sac which were sent for histopathological examination. Post-operative recovery of the patient was uneventful, and then the patient was discharged with an advice to come for follow-up on the 5th post-operative day. Review of literature. Incidence of ectopic pregnancies in general. Nowadays, in every 40 to 25 pregnancies, at least one of the pregnancies is being an ectopic pregnancy. The most frequent locations are 90 to 95% of the cases are found in fallopian tubes. The less frequent locations are 2% of the cases in the interstitium of the tube, 1 to 2% of the cases in abdominal cavity, 1% in the ovary, 1% in the accessory horn in the biconvoid uterus, and cervical. Last but not the least, the Caesarean scar being the most rarest of all, 0.05%. Implantation of the pregnancy within the scar of a previous Caesarean delivery is the rarest of the ectopic pregnancies. Only 19 cases have been reported in the English medical literature since 1996 up till the year 2001, and the first case was brought to light in the year 1978. Scar implantation is a gestation which is completely surrounded by the myometrium and the fibrous tissue of the scar and separated from the endometrial cavity, unlike the normal gestation sac which is present within the endometrial cavity. The predisposing factors, previous pelvic inflammatory diseases, pelvic tuberculosis, intrauterine contraceptive devices, progestogen only pill users, previous tubal surgery, in vitro fertilization, gamete intrafallopian transfer technique, and previous ectopic pregnancies. Spontaneous miscarriage, and these conditions have to be differentially diagnosed. Ectopic scar pregnancy have to be differentially diagnosed from the following conditions, like spontaneous miscarriage in progress, trophoblastic tumor, cervicoischemic pregnancy, lowly implanted intrauterine pregnancy. The complications are, it should be diagnosed as early as possible as it carries high risk of myometrial rupture with fatal outcome. It's more life-threatening than placenta previa and accreta because of early myometrial invasion in the first trimester itself, and surgical interventions may compromise with the future fertility. And take-home message. Early ultrasound scan done reveals pregnancy at ectopic locations, and to improve the future fertility is necessary to make a diagnosis as early as possible, even before the ectopic sac ruptures, and this is possible only with a routine ultrasonic scanning in the early pregnancy itself. Early diagnosis is the key to the conservative management. Thank you. And we would like to thank our Dean, Dr. A.Y. Chari, for guiding us in presenting this case, and Dr. Aruna Rachel, Professor and HOD of Gynecology. Cervical pregnancy, cervical ectopic pregnancies, and then cervical carcinoma of cervix. In which pregnancies? Cervicoischemic pregnancies. Cervicoischemic pregnancies and yes.
Any irritation to the peritoneum?
No, ma'am.
Any irritation to the peritoneum will cause cervical movement tenderness. See, now you gave the risk factors.
Yes,
They
ma'am.
are all for tubal pregnancy. Ours is a Caesarean section, scar, pregnancy. What are the factors for it?
Previous cesarean sections, most probably.
All previous sections,
Not all, but
very rare.
very rarely, but most
Multiple
probably it
cesarean
is
sections.
multiple cesarean sections. Ma'am.
What is the Caesarean section?
Delayed implantation also. Delayed implantation of the gestation. Delayed implantation of the embryo. IVF. And progestogen only pills also may lead to delayed movements of the fallopian tubes, ma'am. Even that may be one of the reasons. So that may delay that may delay in the implantation of the embryo. Because on performing DNC there is a chances of perforation. So. No, ma'am. We have taken her consent, ma'am. We have taken her. Hmm. We'll first ask if whether she's. There are chances of future infertility, ma'am. No, hysterectomy.
You are lucky you have gone through hysterectomy, but usually what will happen? What is the outcome? What is the main surgery?
In the further, in if she's pregnant for the next time, then there are high chances of rupture. Yes, ma'am.
They are taking consent to
We have taken her consent, ma'am, for both hysterectomy as well as tubectomy. The myometrium, the thickness of the myometrium varies in these two conditions. In case of cervicoischemic pregnancy, myometrium is normal, whereas in case of Caesarean scar pregnancies, the myometrium is thin, less than 5 millimeter.
Empty uterine cavity, empty cervical canal, and myometrium is defective where the gestational sac is present.
complications you have left no. If you are not done tubectomy, complications of during surgery and post.
Complications during surgery. Milking of fallopian tubes.
No, not tubectomy. You have, for this case, you have done tubectomy.
Yes.
If you don't do tubectomy and leave her, that is one thing. And during the surgery, intraoperative complication.
Intraoperative
And if you have left without doing tubectomy, what are the complications?
Well,
Next pregnancy may also be an ectopic pregnancy,
And scar.
scar ectopic pregnancy, and during the operative procedure, the trophoblastic cells may leading to hemorrhage.
All is given in shortly. I don't know anything other than short.
Repeated cesarean sections, ectopic pregnancy. The patient may get an ectopic pregnancy at any location which is highly prone for hemorrhages, and hemorrhage may lead to shock and with a fatal outcome. Rupture of the uterus, life threat.
wasn't accurate.
Yes, ma'am.
That is an indication. Caesarean section has to be done. Then tell them that this is a complication can happen. So they should undergo sterilization along with second pregnancy once she delivers. Okay. Thank you.
Thank you, ma'am.